This stew will be ready in no time.
You don't look so good. Are you okay?
I ache all over, and I have a fever.
By nightfall on March 11th, the Fort Riley cook checked into the Army hospital.
His symptoms came on unusually fast.
Could be influenza. Let's keep an eye on him.
Influenza spread swiftly among the soldiers at Fort Riley.
John, is it cold in here?
Feels warm enough to me, Sam.
Hey, you look terrible. I feel awful, and I ache all over.
And you have a fever. Let's go see the doctor.
Within days, patients poured into the Fort Riley hospital.
I never felt this sick in my life. You're not the only one. The hospital is full.
This flu comes on so fast and kills just as quickly. Some of these men were healthy this morning and now they're dead.
This flu is killing strong young men. It doesn't make sense.
In 1 week, almost 500 Fort Riley soldiers came down with the flu. Within a month, 1,100 soldiers fell ill. 48 of these men died of pneumonia brought on by flu symptoms. Soldiers from Army bases throughout the United States traveled by ship to the war zone in Europe. The ships were crowded and cold.
You all right, Private?
I felt fine when we left Fort Riley. Now I can barely breathe.
You're burning up with a fever.
Some soldiers on military ships died from the flu before reaching Europe. U.S. soldiers brought the flu virus with them to Europe. Soldiers packed in narrow, damp trenches fell prey to the killer virus. The flu passed to English, German, and French soldiers. Soon the virus spread all over Europe.
Fire, men!
In Europe, the flu virus changed and became a stronger and deadlier virus.
The fighting has been heavy. Many men are dying. Most of these men have died of the flu, not in battle.
Chapter 2. The danger spreads. Wartime ships carried the killer flu along trade routes to people in port cities. Near the end of August 1918, major port cities in the United States, Africa, and France were hit with the flu at the same time.
This is the last of the cargo. That's a terrible cough, mate. I didn't feel so bad this morning, but now I can't stop coughing.
The killer flu soon spread throughout Europe, Africa, Asia, the South Pacific, and North and South America. At first an epidemic, the flu was now a worldwide pandemic. When U.S. soldiers returned home, they brought this new deadly flu with them. This stronger flu virus soon infected people in the eastern U.S. port cities of Boston, New York, and Philadelphia. The flu was easily spread by breathing and coughing. Every time someone coughed or sneezed, millions of disease-causing organisms were released into the air.
Achoo!
We've admitted 50 more flu patients this morning.
We've lost 10 patients to this flu today alone. We have an outbreak on our hands, and I don't know how we're going to stop it.
The killer flu followed the soldiers back to their army bases and was soon passed to healthy soldiers. In September 1918, Dr. Victor Vaughn, an Army medical official, investigated a flu outbreak at Camp Devens, an Army base near Boston.
Nurse, how many men are ill with the flu?
Hundreds, Dr. Vaughn. And more sick men are waiting for beds.
This infection, like war, kills the young, vigorous, robust adults.
On the day Vaughn arrived at Camp Devens, 63 men died from flu symptoms. Vaughn reported his grim findings to his colleagues. I saw hundreds of young, stalwart men in uniform coming into the wards of the hospital. Their faces wear a bluish cast. In the morning, the dead bodies are stacked in the morgue like cordwood. Despite the rising number of deaths from the killer flu, people took little notice of flu reports. Instead, people turned their attention to the war effort. They had no idea that a dangerous virus lurked in the air.
Together we win! Hurrah!
In Philadelphia, 200,000 people filled the streets to march in support of the war. The invisible killer flu spread fast.
The hospitals are all full. We'll have to care for Jeremy at home.
I fear I'm getting ill myself. I pray that little Lizzie doesn't get sick too.
Within days, the virus exploded across the East Coast. On October 4th, at least 600 people in Philadelphia were ill with the flu. By November, Philadelphia reported 47,094 cases of the flu and 12,191 deaths from the disease. Hospital workers put themselves at great risk by treating flu patients.
I'm worried about bringing the flu home to my family. I'm worried about myself. I feel terrible.
In some areas, makeshift hospitals were built to handle the growing number of flu cases.
Doctor, we're short of staff. 3 of our nurses have the flu.
Other hospitals face the same problem. We'll have to do the best we can.
Healthcare workers were overwhelmed by the number of flu victims. The large number of deaths created an unexpected shortage.
Why haven't these poor souls been buried yet?
We're out of coffins, and the undertaker has come down with the flu.
Fear of the flu caused some cities to ban public funeral services as well. People sick with the flu were often quarantined. They were not allowed to leave their homes and could not have visitors.
Now that our house is quarantined, I can't go to work. What are we going to do for money?
Chapter 3. The Search for Answers. While major U.S. cities were battling the flu pandemic, small rural communities in the Midwest were just learning about the outbreak.
I had a little bird. Its name was Enza. I opened the window and influenza.
I hope this flu everyone is talking about doesn't come here.
Could the flu find its way to our little town?
The killer flu caused people to fear one another.
Good morning!
Go away. You might have the flu.
Their fears were for good reason.
How did this happen? They were healthy just yesterday.
Scientists were stumped by the flu. They scrambled to find both a cause and a cure. At that time, microscopes were not strong enough to see tiny flu organisms.
If only we knew what caused this disease. We might know how to stop it.
As scientists searched for answers, health officials tried to protect the public. In large cities, people were forced to wear gauze face masks in public.
Put this on, ma'am.
Must I?
It's the law. These masks may keep the flu from spreading.
Gathering places like schools, theaters, and restaurants were closed because of the flu.
All these laws and still the flu keeps getting worse.
You can't get on this bus without a mask. I don't need a mask. I'm not sick. Doesn't matter. It's the law.
Many medical doctors treated flu symptoms with aspirin and bed rest.
Give him another dose of aspirin, nurse, so he rests more comfortably.
But their treatments often did not work. Flu symptoms turned into pneumonia, which was sometimes deadly. When traditional treatments didn't work, some doctors turned to other remedies.
What's that?
Gelsemium. This herb will help your body heal itself. You'll be up and running in no time.
Many people treated the flu at home. Some used folk remedies.
I've heard of families who eat nothing but onions to stay healthy. They still got the flu. Well, my mother always gave us plenty of chicken soup, and what worked for her works for me. This camphor ball smells bad, but it will keep me safe from the flu. Mother also gave us kerosene when we were sick. Take this kerosene to ease your flu. I added some sugar so it won't taste so bad.
Although people tried herbs and home remedies to fight the flu, many still got sick.
The U.S. Congress gave the Public Health Department $1 million to hire more doctors and nurses to fight the flu. Meanwhile, Army labs and other scientists worked to control the outbreak.
None of the previous vaccines have worked. We still don't know why this disease is so deadly. This new vaccine is ready to be tried on the public. Let's hope it works.
In San Francisco, 20,000 people were vaccinated against the flu.
Hold your arms still, please.
Hold still and be brave.
You don't want to get the flu, do you?
But the new vaccine didn't work. Many people in San Francisco got the flu, even after receiving the vaccine.
I feel so helpless. I've done everything to protect my kids, and still, they've come down with the flu. Why can't doctors stop this disease?
How can we fight a disease that we don't understand?
Chapter 4. The Killer Vanishes. By late fall 1918, doctors around the world reported a decline in flu cases.
Doctor, the flu ward is nearly empty. Do you think the flu outbreak is letting up?
We haven't had a new flu case in almost a week, but it's too soon to tell if the outbreak is over.
In November 1918, Americans celebrated a victorious end to World War I. People also had something else to celebrate. The killer flu seemed to be disappearing. A third wave of flu cases occurred in early 1919. By mid-year, the flu was reported in fewer and fewer numbers until the last cases were treated by late 1919.
How could a deadly disease just go away?
Perhaps the virus just ran out of people to infect.
The flu of 1918 changed people's lives forever. In just 120 days, at least 1/3 of the world's population got the flu. At least 40 million people died.
Can Jimmy come out and play, Mrs. Tucker?
Jimmy had the flu. I'm sorry. He didn't survive.
As weeks passed, life slowly returned to normal.
Good morning, children. I'm glad to see you back at school.
During the pandemic, scientists did not determine the cause of the flu. Scientists today have uncovered the virus that caused the 1918 flu. They are closer to understanding why that flu strain was so deadly. Yet one question continues to worry scientists and doctors alike.
Could a similar killer flu strike today?